Checking for danger, no obvious dangers. Now some help in here, please. Annie, open your eyes. Open your eyes, Annie. Open your eyes. No response. Not breathing. 199 on speaker. Okay, so that is Dr. ABC in practice. Check for danger in the doorway, don't even come in until you're sure it's safe. Call for someone, call for some help. If you're on your own, might open the door or something so you've got some free access for paramedics. You get hopefully getting a response from somebody and trying to get a response from the patient. So yell at them from a distance, see if you get any kind of twitch, yell at them close down and just tap on the shoulders to see if there's any kind of reaction. No reaction, then you go on to your ABC. So airway, 2 fingers under the chin, palm of your hand on top of the head and tip back. This moves the jaw and the tongue forward so the airway is clear. In some cases just doing that and they'll breathe. If not, okay dudes, you want to come down, look, and listen. Ideally you want to be close enough that if they really wanted to, they could stick their tongue in your ear. It's that close so you can hear anything that's going on here and you're looking along the body so you can see if the chest is moving. Now that you do for a full 10 seconds. It seems like the longest 10 seconds in the world, but if you don't hear any kind of normal breathing in that 10 seconds, then their heart has stopped and they need resus. If you hear kind of gaspy sound, their heart is not working, they need resus. If they are not breathing in a normal manner for that 10 seconds, they need resus. Full stop. So then it's the ball of your hand in the middle of the chest, pull back your fingers with the other hand and just start compressing. It depends on your relative size to your patient. If you are a big 18-stone rugby player, you're not going to put in all your weight on a 85-year-old lady. You probably want to go for one hand. But most of the time it's 1/3 of the distance down, which is about 2 inches, 5 centimetres on an adult, an average adult, but not everyone's average. And again, if you're resuscitating a child, one hand might be better. If your patient has got silicone boobs or is pregnant, you're not going to be able to get in there properly. So fist and use that part of your hand and just support your wrist like that. So, and you're compressing to whichever song you prefer. There is Staying Alive is the one that the Royal Heart Foundation use, and Nelly the Elephant, something like that. If you're aiming for around about 100 to 120 beats per minute, which doesn't seem like very much, but you've got to think that adrenaline is going to help you quite considerably with this, so you're going to get faster anyway. And think about your position relative to your patient. Remember you've got an arm here, so you're going to be that much further away, and if you balance yourself over them, keep your arms locked out, don't bend your arms, and just come straight down. So the movement is coming from your hips, not from your shoulders, because that tires you out too quickly. So essentially, that is what you do. And if you have one of these handy, call 999 or 911 and put it on the speaker, so that even if your stressed out brain forgets, someone on the other end of the line will tell you what to do. Now, if you're somewhere public, then try and get someone to go and get you an AED. Now, this is a training version, so it's pretty standard, but the thing about AEDs is they are idiot proof. They really are. So inside you'll normally have your pads, the machine, you normally have a towel or some kitchen roll and maybe a razor. If someone's had a heart attack, they're going to be sweaty, so you want to dry them off so that the pads will stick. Turn on the machine.
Apply pads to patient's bare chest. Plug in pads connector next to flashing light.
As I said, it's idiot proof. It tells you what to do. And the pads have got a indication of where they go.
Apply pad.
Yes, alright.
Plug in connector.
And you just look at it.
Analyzing heart rhythm. Do not touch the patient.
Now you need to make sure that no one is touching at all, because the machine can read someone else's heartbeat.
Shock advised. Charging. Stay clear of patient.
Stand clear. Make sure you say
Deliver
that loud
shock
and mean it.
now. Press the orange button.
Press the button
now.
when you are ready. Stand clear.
Shock delivered. Paused. If needed, start CPR.
And then back on the chest again. This thing is idiot proof. It will only shock when the heart is in the right condition for it to work. Turn off. After 3 minutes it will tell you again. It will scan again and it will shock again if it's needed. The machine will only shock if the heart is in what they call fibrillation. And you have 4 different states to the heart. You have normal sinus rhythm, which is your 60 to 80 a minute. You have nothing. You have PEA, which is essentially it's beating but there's no blood there. And then you have fibrillation, which is kind of bag of worms. All the muscles are working but not working together. And the point of an AED is to stop everything. It's called a heart start machine, but it doesn't start the machine. Start the heart. It stops it, and then it gives it a chance to come back. But that can take some time for things to reorganise themselves. So you carry on with CPR if it tells you to. So that is Dr. ABC for an unconscious, unresponsive patient, and this will save someone's life. I'll see you next week for what to do if they are actually breathing. What I forgot to mention was if after a minute or so after a shock they start to come round, they start to breathe or make some noises, you stop what you're doing and go back to Dr. ABC. So again, you check for danger just on the off chance. You talk to them, yell at them, ask them to open their eyes, see if you can get some sort of response from them. Then you check your ABCs again. So you tip the head back and listen for breathing. If they've got a good breath every 2 or 3 breaths every 10 seconds, then you can then treat them as a unconscious breathing casualty. If it's not a normal breath, then you carry on.